This is Plant-Based Briefing. Potatoes. What about diabetes, blood pressure, blood sugar, and more? Part 2 by Michael Greger, MD at nutritionfacts.org. I'm Marian Erickson. This is the Plant-Based Podcast where I curate a variety of articles on plant-based and vegan living, get permission, and narrate them to you here in about 10 minutes or less every weekday. Today's article would have been longer than that, so it's a two-parter. I read the first half yesterday, so go back and listen to that first, and then jump back here for part 2. And now let's get to today's Plant-Based Briefing. Potatoes. What about diabetes, blood pressure, blood sugar, and more? Part 2 by Michael Greger, MD at nutritionfacts.org. The Potato Glycemic Index. Foods with a glycemic index, or GI, above 70 are classified as high GI foods, and those with a GI of lower than 55 are low GI foods. Pure sugar water, for example, is often standardized at 100, and white bread and white potatoes are high glycemic index foods. Is there any way we can lower the glycemic index of potatoes? When potatoes are boiled, then cooled in the refrigerator, some of the starch crystallizes into a form that can no longer be broken down by the starch-munching enzymes in our gut. When put to the test, researchers actually saw a dramatic drop in glycemic index in cold versus hot potatoes. So by consuming potatoes as potato salad, for instance, we can get nearly a 40% lower glycemic impact. The chilling effect might therefore also slow the rate at which the starch is broken down and absorbed. So individuals wishing to minimize dietary glycemic index may be advised to pre-cook potatoes and consume them cold or reheated. The downside of eating potatoes cold is that they might not be as satiating as eating hot potatoes, but we may get the best of both worlds by cooling them and then reheating them, which is exactly what was done in a famous study I profiled in my book, How Not to Diet. The single most satiating food out of the dozens tested was boiled, then cooled, then reheated potatoes. There's an appetite-suppressing protein in potatoes called protein protease inhibitor 2, but the way potatoes are prepared makes a difference. Both boiled and mashed potatoes are significantly more satiating than French fries. That was for fried French fries, though. What about baked fries? Individuals had a big drop in appetite after eating boiled mashed potatoes compared to white rice or white pasta, which is right where fried French fries were, as well as baked French fries. Do potatoes spike our blood sugar? White potatoes have a high glycemic index, as I mentioned, and consumption of high glycemic impact foods may increase the risk of diabetes. Normally after a meal, we'd like our blood sugars to just gently, naturally rise and fall. But with high glycemic foods like potatoes, we can get an exaggerated blood sugar spike. That leads our body to overcompensate with insulin, forcing our blood sugars lower than when we started, which results in negative metabolic consequences, such as a rise in triglyceride fats in the blood. However, potatoes are a good source of potassium, vitamin C, and polyphenols, which may counterbalance the glycemic impact. This may explain why potatoes appear to have a neutral effect when it comes to lifespan, unlike other whole plant foods that have been associated with actively living longer. How to reduce the GI of potatoes? Aside from the chill and reheat method to dramatically lower the glycemic index of white potatoes, is there another way? Yes, and it's the same way we make everything better in our nutritional life. Add broccoli. The co-consumption of 2 servings of cooked broccoli with mashed potatoes immediately cuts the insulin demand by nearly 40%. In contrast, adding chicken breast makes matters worse, and adding tuna fish is even worse still, nearly doubling the amount of insulin our body pumps out. Why does plant protein make things better, but animal protein makes things worse? Because decreased consumption of branched-chain amino acids improves metabolic health. I cover this in my book, How Not to Diet, as well as my video on the topic linked here. Something else can help too: vinegar. Simply chilling potatoes may cut down on blood sugar and insulin spikes, but to get significant drops in both, just add about a tablespoon of vinegar, even plain white distilled vinegar, to drop levels by 30 to 40%. Just 1 to 2 tablespoons a day of vinegar diluted in water can significantly improve both short and long-term blood sugar control in people with diabetes, which is why clinicians may want to incorporate vinegar consumption as part of their dietary advice for their patients with diabetes. You just listened to Potatoes. What about diabetes, blood pressure, blood sugar, and more? Part 2 by Michael Greger, MD at nutritionfacts.org. And I'm your host, Marian Erickson. If you want to listen to some related episodes, you can go a bit further or deeper into these topics by checking out 212, Do Potatoes Increase the Risk of Diabetes? 216, do potatoes increase the risk of high blood pressure and death? 224, glycemic index of potatoes, why you should chill and reheat them. And 241, how to reduce the glycemic impact of potatoes and the healthiest type of potato. Those are all by Dr. Michael Greger at nutritionfacts.org, and they will be linked in the show notes. So please share this episode with anyone who might benefit, and thanks for listening.